You have a choice between HMO and PPO plans. HMO stands for Health Maintenance Organization, and PPO stands for Preferred Provider Organization. Both offer a wide variety of medical coverage without the need for a referral, and emergency medical treatment can be received anywhere care is needed worldwide. The difference between the two is that having a PPO gives you the ability to see a provider that's either in-network or out-of-network, where with an HMO, you must stay within the HMO's network unless it's an emergency. An in-network provider participates within a health plan network, and members pay less because these providers have negotiated discounted rates with Florida Blue. An out-of-network provider does not have contracted rates with us, and therefore out-of-pocket costs will be higher. Some of our HMO plan networks are known as Blue Care or simply Blue. With an HMO, you'll need to choose a primary care physician, also known as a PCP. If you do not select one at your initial enrollment, Florida Blue will automatically assign one to you based on your zip code. But don't worry, you can always change your PCP anytime. Just make sure you use in-network providers for your HMO plan. A PPO plan does not require you to choose a primary care physician, and you're free to see whomever you choose, in-network or out-of-network. Of course, staying in-network is always the best way to help lower your healthcare expenses. Some of our PPO plans are also known as Blue Options, Blue Select, or Blue Choice. We've included links below for you to search for providers in the HMO and PPO networks. As a Florida Blue HMO member, you and your covered dependents have coverage for certain services when you're away from home. We also offer separate programs for short trips and long-term stays. For those with a PPO plan and wish to search outside of Florida or worldwide, links are provided at the bottom of the online provider directory search page under Other Provider Searches.